Hi, I am Dr. April. Welcome back to my channel. If you are new here, I help Black women navigate racism and workplace issues. In addition to that, I founded the Wellness Room to help people just like you prioritize their mental health, elevate their wellness, and embrace self-care. So if that sounds like something that you are interested in, go ahead and subscribe to my channel so that you don't miss out every time I post another video. Make sure you hit that notification bell. And in addition to that, I post a new video here every week. So stay tuned, and I look forward to seeing you along this journey. Let's get into the topic of this video. So in this video today, I'm going to talk about the mental health effects of racial trauma. Not only am I going to talk about the mental health effects of racial trauma, but I'm also going to talk about the physical effects of racial trauma. I'm going to talk about some of the different feelings and emotions that may come up as a result of experiencing racial trauma experiences or racial discrimination in the workplace. And then last but not least, stick around until the end of this video because I'm going to talk about 3 ways to cope with race-based stress or racial trauma. All right? So let's get into the video. So some of the mental health effects associated with racial trauma, which are consistent with post-traumatic stress disorder or PTSD, and they include flashbacks, nightmares, hypervigilance to threat or sensitivity to threat. You might also experience avoidance or suspicion as well. And so some of the same symptoms that are consistent or similar to post-traumatic stress disorder are also similar in racial trauma experiences. Another common mental health challenge or mental health challenges that people encounter are also anxiety and depression. So oftentimes anxiety and depression also comes up as a result of experiencing racial trauma. Okay, so some of the other mental health challenges that come up as a result of experiencing racial trauma in the workplace, particularly that for Black women, what we see a lot of times is struggles around authenticity. So not feeling 100% comfortable being yourself, feeling comfortable in your own skin, so to speak. And so a lot of times what we're seeing in the workplace is that Black women oftentimes will alter their dialect. So you may see code switching a lot. Also not feeling comfortable to wear their natural hair in the workplace or just to be themselves, so not feeling completely comfortable in your own skin is very common with racial trauma. And also we see a lot of issues around self-worth, low self-esteem as well. As a result of experiencing racial trauma, there may also be some perfectionistic tendencies. So just being afraid of making a mistake. And also Black women tend to internalize racism more than Black men. What is another common thing that Black women might experience is strong Black woman syndrome or superwoman schema. And basically this schema suggests that Black women should be strong, show no emotion, are very independent, and selflessly care for the needs of others. And then another thing that's common is imposter syndrome, right? We are all familiar with imposter syndrome. It comes up for us in different areas of our lives. It basically suggests that ultimately women tend to feel like a fraud. Despite their high achieving accolades and their accomplishments, somewhere deep down, you're saying to yourself, I don't deserve this, or I'm not good enough. And that's also very common. So that covers mental health challenges that may come up as a result of experiences of racial trauma. So let's talk a little bit more about some of the physical effects of racial trauma. And what we tend to see very commonly is that folks experience heart palpitations, headaches. You might also have trouble sleeping at night, tossing and turning, racing thoughts. People also tend to have hypertension, right? And in addition to the hypertension, you might also experience some of the very common illnesses or chronic diseases that we see among Black people can be a result of experiencing racial discrimination or ongoing racial discrimination or ongoing exposure to racial discrimination. And that includes diabetes, heart disease, cancer, and stroke as well. So these are just some of the physical things that can be happening as a result of race-based stress and the ongoing exposure to racial trauma. Moving along. So let's talk about some of the feelings that might come up as a result of experiencing racial trauma. So typically, for starters, people are angry, right? They're frustrated. They might also feel shocked, like, I cannot believe that this is happening to me. Another thing that's very common is feelings of guilt and shame, right? And then also feeling outraged, feeling very disrespected and disgusted with the situation. And a lot of times people don't really know what to do with all of those different emotions that they're feeling. But another thing, people also feel insulted. And a lot of times they don't know what to do with what it is that they are feeling and those emotions that come up. And so a lot of times people just sit with it. You go home, you sit with it, you replay the situation or the circumstance over and over again in your head. And so a lot of times people feel very frustrated because they don't know what to do about that. And so these are some very common feelings. I want you to know that the feelings that you are experiencing are very normal. They are also very common as a result of what you've encountered. So keep that in mind. Last but not least, I really want to spend some time getting to the good stuff. But before we get there, if you have not hit that like button, go ahead and hit that like button. If you have not subscribed to my channel, go ahead and hit that subscribe button so that you don't miss out on this valuable content that I will post here every week. And also, in addition to that, I want to also invite you or let you know that there are racial trauma resources available on my website. If you click that link in the description box, you will see my website. And on my website, you're going to hover over therapy and click on racial trauma. When you scroll all the way down towards the bottom of the page, you will see a list of racial trauma resources that are readily available for you. Not only are there resources to help you cope with racial trauma in the workplace and just to learn more about racial trauma, but there are also really great resources or books available as well that you can read so you can learn more about racism and the historical context about racism and racial trauma and where all this came from and how it all started and why it's still affecting us today. So be sure to check that out. It is readily available to you today. All right. So as I promised, if you stuck around to the end of the video, I was going to talk to you about 3 ways that you can cope with race-based stress or racial trauma. And so the first thing that I want to recommend to you is therapy. Yes, therapy. As you guys know, I'm a licensed therapist, so I am a big advocate for therapy. I have done therapy myself. I'm still in therapy. I talk to my therapist every week. So I'm always going to suggest that you go to therapy. But let me give you some quick tips about therapy in general and what you should be looking for. So for starters, you want to make sure that the licensed therapist or licensed professional has some experience with race-based stress or racial trauma. This is critical, right? Like if something is going on with your teeth, you're not going to go and see a physical therapist. You're going to go to the dentist, right? So you want to also make sure that your therapist specializes in the area that you need help with. So make sure they have a specialty in race-based stress or racial trauma, or at least familiar with it. And then also, if they have a specialty in EMDR or eye movement desensitization and reprocessing, that is great. Also, if they are familiar with or are certified in trauma-focused cognitive behavioral therapy or TFCBT, that is also wonderful. You also want to make sure you get a therapist that does integrate some sort of safe place imagery as well. Last but not least, you want to make sure that they're giving you culturally relevant approaches or healing approaches that pretty much align with who you are and your race and your ethnicity, right? So just making sure that they integrate some type of culturally relevant healing approach in the therapy session with them as well. Okay, so the second way that you can cope with race-based stress or racial trauma is through meditation. I'm a big meditation advocate. I have been meditating for years. It is a big part of my life. And so meditation is a great way to reduce stress and anxiety. Not just that, but it really helps to align the mind and body connection, really mind, body, and spirit. And so I recommend meditation. So I would find a mind body meditation app. There are several free apps out there that you can access for free. In addition to that, I don't know if y'all heard Little John's new album called Total Meditation, but download that on your music streaming service. It sounds really good. I am so surprised to hear that he has jumped over from the rap and the hip hop stuff into the meditation scene, but I'm all here for it. Like, it's really dope. So make sure you guys check that out. Download it on Apple Music, or if you use Spotify or Tidal. It's a great soundtrack to listen to meditate and relax. And, ultimately with meditation, you just want to make sure that you find a quiet place. You can sit down, you can lie down, you can sit on the floor, crisscross, whatever feels comfortable for you. But it's really just being intentional about connecting to your inner self. It really helps to restore your inner peace as well. And in addition to that, yes, meditation is also a great way to ease the mind and body, right? And so meditating is super helpful. So look into doing that, trying that. You can also find guided meditation videos here on YouTube. So do a little bit of research, see what works for you. And also, I know a lot of people are hesitant to try meditation because ultimately meditation requires stillness, right? And a lot of times we don't like to be still. We like to be on the go. Don't like to rest like we should be resting. And so a lot of times people find meditation difficult. Another thing people say when they first start meditating, and I experienced this myself, is that typically you are going to have some thoughts that come up. You are going to be thinking about something else, thinking about what you have for lunch, thinking about what you have to do in the beginning. That is completely normal. That is fine. As you continue to practice and as you continue to meditate, you will get better at really being able to bring your mind back and recenter yourself. And so when those thoughts come up, don't judge them, let them pass, and try to do your best to redirect yourself to focusing on stillness and really settling into that inner peace that you're looking for. Okay. All right. So the last way that you can cope with race-based stress or racial trauma is journaling. I love journaling. Journaling is the perfect way to release built up or pent up emotions. It is a wonderful emotional release. I cannot stress this enough. Journaling, once a day or journaling a few times a week is great. I know oftentimes our first thing is to get on the phone and vent and call someone. But what if you just sat still and you just decided to just journal? Like, just write out how you feel, no judgment, get it out on paper, get it out of your head, get it on paper where you can see it. And ultimately what journaling does is it just helps you really to process your emotions, right? And it's a judgment-free zone as well. Sometimes the person that you used to calling, you may feel like, I don't want to bother them, or they stop answering their phone for you. So you need another way. So journal is a great way. You can find a journal at your Dollar Tree for $1. You can find, well, it's $1.25 now. And then another thing, Amazon has some really nice ones for $5 to $20. I get my journals from Amazon. I love my journals on Amazon. And yeah, and just remember, there's no right or wrong way to journal. The most important thing is that you just let whatever you feel out, let it flow. And then another thing, journaling really helps you to really reflect on those racial trauma experiences as well. So you can literally get out of your head what you've been replaying the situation, really write it down. And after you write it down, if you like, you can go back and read it, or you don't have to. You can also just let it out, let it be done, close it, and that's it, right? So journaling can be very helpful. So far in this video, we have talked about the mental health effects of racial trauma. We've talked about the physical effects of racial trauma. We talked about the kinds of feelings that might come up as a result of experiencing racial trauma in the workplace or racial discrimination as well. And finally, we covered 3 ways that you can cope with race-based stress or racial trauma. And that was through therapy, meditation, and journaling. So I hope that you found this video helpful thus far. Let me know if you have any questions. I would love to hear from you. If you've experienced some of those feelings, put them in the comments below. If any of this connected with you, please share. If you have a friend or family member who could benefit from this content as well, share it with them. Share it with a friend. And earlier when I talked about therapy as a way to cope with race-based stress, I also have a very valuable and free resource for you available on my website. If you click that link in the description box and you scroll all the way down to the bottom of the page, you will see a place that you can enter your name and your email address. From there, you will get my free resource, 15 questions you should ask before you hire a therapist. This resource will be a great way for you to make sure that therapist is a good fit, to know what to look for, especially if it's your first time in therapy, or if you've been in therapy before, but you've had not a great experience. This will be a great way for you to find a good therapist that works for you ultimately. And so check that out, get that free resource. If you have not already, hit that like button, hit that subscribe button as well, and make sure you tap that notification bell so you don't miss out when I post another video. If you found this video helpful today, don't forget to share it with a friend. I am rambling now, but I want to make sure that I don't leave anything out that I needed to tell you guys. But anyway, if you have not checked out the first 2 videos, go back and watch those 2 videos, because I didn't realize it, y'all, but I'm really making a series here. So this is really a whole racial trauma series that I'm making. And so if you watch the first 2 videos, it'll give you some context on what I'm talking about in this video. So make sure you check those out. I'll also have those linked in the end screen as well, or the outro towards the end, so that you can go back and watch those 2 videos. And again, thank you so much for returning to my channel. Remember, taking care of yourself is a journey, not a destination. Thank you for subscribing and prioritizing your well-being with me. So take care. Bye. I will see you next time. Thank you.